About the muscles of the tongue, and then we're going to look at muscles of the floor of the mouth and the neck. We'll take a break and do lab time, so you guys can be looking at the models. We'll come back and do muscles of the, move on and do muscles of the deep back as well, and then we'll take another break and do muscles of the superficial back and chest. But your quiz on Tuesday, the lab quiz on Tuesday, will stop with muscles of the deep back. So when we get to that point, the last muscle I'll talk about that's on the quiz is the quadratus lumborum. Okay, so if you're wondering what the quiz is going to cover for Tuesday. And we actually will end up being, since we had lecture on exam day last week instead of the lecture exam, we actually today are going to be a day ahead of our schedule. So you'll have more review time at the end of next week or the following week without having brand new material 2 days before the test. Okay, so we could have that additional lab time. All right, so we finished off yesterday by talking about muscles of the chewing muscles, the temporalis, the two pterygoids, and the masseter. And what's the nerve that innervates those muscles? Trigeminal. Three. Yes, the third branch of the trigeminal nerve. So now we're looking on page 76 as muscles of the tongue. And on this diagram, if you want to get the head models again, we don't have quite as many out there because the rest are back in the room where they came from. But on the sagittal view of the tongue, we can see some of the tongue muscles, and then I'll bring back that small, sorry.
Oh, she's got a mustache.
It's more,
I'll take that from you, Rachel. Oh, you guys managed to.
and then the small larynx here. Some of the other tongue muscles.
It's just stare.
So, yes. In the front of the jaw, we have this component of the mandible, which is the genu of the mandible. And so muscles that attach to the genu have the prefix genio. All right, so genioglossus, and then later today, we'll look at geniohyoid. All right, so we have then genioglossus is our suffix for tongue, or glossal. So our nerve for muscles of the tongue is the hypoglossal. We have two of them, hypoglossal nerves, cranial nerve 12. So again, you should be familiar with that. It should be a brand new piece of information. And so the genioglossus muscle is going to have its origin off of the genu of the mandible. And it is the largest of the tongue muscles, and it forms this fan-shaped component of the muscle. And so the function of this is to push the tongue outward.
Where's the mouth? I'm sorry.
So if you look at this here, it's the same direction. Okay. So on the surface of the tongue, we have what are the intrinsic muscles that you use to curl the tongue or to roll the tongue. And those are unnamed muscles that are found on the surface. All right, so just intrinsic muscles of the tongue. You want to look at the surface of the tongue, which would be like that. Okay? And then we would have the genioglossus. So for those of you that don't have the head model out, it would be this whole portion right here, forming basically the body of the tongue. Okay? Anybody ever eaten tongue?
Cow tongue.
Is it chewy?
It's just like if you're biting your tongue.
Oh,
It depends
okay.
on how long you cook it. That's the only reason I knew it was tongue versus regular meat.
Yeah.
It's because when I was chewing it, like, you kept chewing and chewing and chewing, and it would not, like, break down.
So was it served as its own or in another dish?
My grandma used to, like, make it with, you know, veggies and, like, all that kind of stuff. But I didn't know. I thought it was just meat until she told me, and then I'm like, ooh. Yeah, I couldn't eat it.
Alright, so this is genioglossus. The origin is the genu of the mandible, and insertion is just into the body or the tongue itself. You'll notice that each of these muscles has the ending glossus for tongue. So the next muscle is styloglossus. And on this model here, you're only seeing a portion of it. But where is the styloid process of the head? The temporal bone? It's going to be up here, behind, just anterior to the mastoid process. So descending from the styloid process of the temporal bone, we have the styloglossus. And it comes from this down the side of the mouth and inserts into the back of the tongue, and that would be this one right here. So because its origin is superior and posterior to the tongue, when it contracts, it's going to pull the tongue up and back towards the oral pharynx, towards your throat. And, excuse me, that's what happens when you swallow. So food is pulled up and pushed up and towards the back of the mouth, back here. So the styloglossus is going to be coming in from the side like this. Okay. Now this bone is what bone right here? Hyoid bone. So if we put this model back together like this, you can see that lateral and posterior aspect of the tongue. We have these two sets of a set of muscles like lateral stabilizers. And so they don't wrap around the entire hyoid bone, but attach from the lateral and posterior aspect. They're going to be positioned in this location. So they stabilize side-to-side movement of the tongue. So you can see here is the styloglossus coming down from the styloid process and hyoglossus muscle. Yes?
The intrinsic muscles that don't have names, are those like the
No.
No.
So they would be these right here. They would be
Like the
what
little
change the
X's.
surface. Yeah, those are what refer to the little X's.
Thank you.
So here's a larger view. And notice we have two muscles here that are coming off the styloid process. So this more anterior one, superior one, is the one we just talked about going from the styloid process to the tongue. So that is styloglossus. This one's going to go from the styloid process to the hyoid bone. So we're going to talk about that next, stylohyoid. Right? So that will help you to keep them straight if you pay attention to their attachments, which is why I give attachments, because it helps you recognize the direction of movements. And here is the genioglossus. So here's the midline of the jaw, the genu of the mandible. And this muscle here showing the different segments is all genioglossus. This is another muscle right here. And then this is a third muscle here that we're going to look at next. So when we look at muscles in the neck, we have a dividing point, which is the hyoid bone. And muscles that are above the hyoid bone are identified as suprahyoid, and muscles that are below, big surprise, are identified as infrahyoid. Suprahyoid muscles have a mixture of innervations, and it's not the ansa cervicalis. So under suprahyoid, you would cross out ansa cervicalis. I'm only going to have you learn the innervation for the digastric, and I'll give those to you specifically for the digastric. So up in the top of page 80, under suprahyoid, just cross out ansa cervicalis as the title of that table. So it says at the very top of the page, it says suprahyoid muscles, and then under that it says ansa cervicalis,
But it's okay here.
but it's fine on the infrahyoid. Okay? All right, so when we look in this region, so suprahyoid muscles are filling in this region right here. I'm going to draw it in a slightly different view. So I'm going to draw it as if you were looking at the inferior aspect of the jaw. So this view here. So this would be a little more balanced. This would be the genu of the mandible. And this would be the mandibular angle, right here. Okay. And then we're going to have the styloid process and the mastoid process. Now, this is looking at the jawline from underneath, and I'm going to start from the deepest view, so we're going to switch to this one. This is looking down inside, all right? I'm going to draw it from this view, but we're going to look first of all at the most superior muscle or deepest muscle. So the floor of the mouth, and then next, and the next, and next, and finally end it with skin. And so looking down inside the jaw, there is a pair of very narrow muscles, more narrow than the width of your little finger, that, because they're suprahyoid, are going to extend between the hyoid bone and the mandible. So these we can find in a sagittal cut. So those of you that have the face models, if you turn and look at the tongue in that face model, you can see, I can borrow yours, Gretchen. You can see right here is the genial glossus, and then there's a pair of white lines, and right in between the two, about 1 centimeter in depth, is the genial hyoid. And then a very thin muscle inferior to that. So the one that I just drew on the board is the genial hyoid. Again, from the genu to the hyoid bone. Now the purpose of movement of the hyoid is when you swallow, these muscles pull the hyoid bone up and the voice box up so that the epiglottic cartilage of the larynx covers over the airway and food moves into the esophagus and not into your trachea. So especially on men that have, you can see they have a larger thyroid cartilage than women do, and you can, but on yourself, even if you're a female, you can feel that go up and down when you swallow. Of course, I can't swallow now that I'm trying to, but you can feel it move up and down. So fibers from the mandible pull on the hyoid and pull the whole hyoid and voice box laryngeal structures up. However, we can stabilize the hyoid and not move that by contracting on the muscles of the neck, and then you can pull, again, we change the origin to the hyoid instead of the mandible, and now we can lower the mandible. So we can change origin and insertion and either elevate the mandible or, either elevate the hyoid or lower the mandible. We just have to change which one is the movable and which one is the non-movable bone of attachment. Now let's look at the next level. So we're going to switch around. We're going to look at this muscle right here, but from this view. This white line is created by the epimysium of these two muscles meeting in the midline. And it's called a raphe, R-A-P-H-E. And so these muscle fibers, I'm going to do this in green so you can see them a little bit better. These muscle fibers, not all of them will go down to the mandible itself, but will be in the midline. So this muscle is known as the mylohyoid, and it forms the floor of the mouth. It's very thin, but it's the only one that extends across the entire space between the rami of the mandible. And so this is the mylohyoid. And that would be this one here. This is not the geniohyoid muscle. Geniohyoid is going to be on the back, on the deeper surface of this, so behind the screen, if you will. So again, depending on what we use as the immovable or movable points of attachments, you can either raise the hyoid or lower the mandible. Actually, I'm going to draw this through because we're looking over it now. Now the next set of muscles are between the skin and the mylohyoid. We have skin, digastrics, mylohyoid, and the deepest would be the geniohyoid. So the next muscle that I'm going to draw is the one that you can see here, and there are a pair of them. These are known as the digastrics. Gastro referring to stomach, but this has nothing to do with the stomach. So here's a better view of the digastrics. Like the superior oblique, they run through a little pulley that is on the hyoid bone. And so from mastoid process to hyoid is the posterior digastric, and from hyoid to mandible is the anterior digastric. So mastoid process to hyoid. Posterior digastric. Sometimes it's called the posterior belly of the digastric. And then this is going to be at an angle. So the geniohyoids, remember, were parallel to the midline. Anterior belly is at an angle. So when we look at a sagittal view, like you have on your heads, you don't see the digastric because it's outside the midline. Here would be the midline, so when we cut, we don't see it at cut edge of the digastric. We just see mylohyoid and geniohyoid. So posterior digastric and anterior digastric. Even though these share the same name, they're called different bellies. I consider them to be different muscles because they have different innervations. So I do want you to know the two nerves that innervate the anterior and posterior digastrics. So, anybody remember the cranial nerve that comes out of the stylomastoid foramen? That small opening between the mastoid process and the styloid process? No? It's a branch of one of our cranial nerves. Comes out, passes through the parotid gland, and spreads across. It has 5 major branches on the face. Facial nerve. All right? It normally does muscles and facial expression, but facial nerve also innervates the posterior digastric, whereas the nerve that innervates the anterior digastric is trigeminal. All right, so those of you that didn't catch the first part when we started on page 80, at the top where it says suprahyoid muscles, cross out ansa cervicalis because that doesn't apply to the suprahyoid. And then the only nerve muscles you need to know the innervation for are the digastrics. So anterior digastric is going to be trigeminal, and posterior digastric is facial. You can just write that in under each of the names of those muscles.
Anterior was trigeminal.
Anterior is trigeminal, posterior is facial. So again, back to the model. On the sagittal view, this large muscle here is genioglossus. Then we have geniohyoid, and finally the thin one at the bottom is mylohyoid, which is forming the floor of the mouth. You can see anterior digastric and mylohyoid from this view, but it's rather compressed and tight. And a little bit of the posterior digastric, but again it's very compressed and tight. So the best model to see posterior digastric, and the next one, the stylohyoid, is actually the smaller torso. Your fill off. Is the smaller torso in the back of the room. Not the large orange one, but the smaller one. So we have one muscle left, and this is the stylohyoid. Remember I showed you on the previous diagram where we have both of them coming down to the hyoid. So, and then the tongue, we had styloglossus going to the tongue, but stylohyoid going to the hyoid bone as a suprahyoid muscle. So we look on this view, styloglossus is missing, but here's stylohyoid coming off of the styloid process. Styloid process is anterior to mastoid process. So stylohyoid muscle is anterior to the posterior digastric muscle. This muscle splits, so it's going to come off, and part of it will go in front of the digastric, posterior digastric, and part of it will go behind it. So that is the stylohyoid muscle. Look at the infrahyoid. And these are muscles that we find below the hyoid bone that pass between the hyoid and partially down or all the way down to the sternum. There's several. There's not any that covers the exact midline of the neck, but the pairs lie just lateral to the midline of the neck. We're learning 3. And on the sternohyoid, I eliminated omohyoid, and omohyoid actually has its origin on the scapula, so I didn't change the origin. So for sternohyoid, if you would change the word scapula to sternum, that only makes sense that it would come up from the sternum. So I'm going to give this individual a really short neck. You're changing scapula to sternum. And we'll put the manubrium here.
Did you already change that on the notes?
No, it's on my notes anyway.
Oh, my color note.
So on page 80, in the midline where it says infrahyoid, and it says sternohyoid, under origin it says scapula. I guess online they're changed. You must have printed those offline. All right, so here's the clavicle. And the larynx, the large cartilage of the larynx is called the thyroid cartilage. So I'm not drawing this to scale. Bless you.
Thanks.
Whew. So this is thyroid cartilage of the larynx. And this is sternum and clavicle. So the deeper set of muscles go just part way. We have sternum to thyroid cartilage. And then we have thyroid cartilage to hyoid bone. So the names of the muscles reflect that. Sternothyroid, and thyrohyoid. On this side, with the sternohyoid actually covers up both of these, so you can see that over here on the diagram. So here is sternothyroid, and then here is thyrohyoid. And the sternothyroid has been cut. Here the sternohyoid is in place. Okay, so that's the longer muscle. And it would be present here, I just haven't drawn it so that we can see those other two muscles. And this would be sternohyoid. So these function to pull the larynx back down via the hyoid. So they're going to either pull the larynx directly if it's the sternothyroid, or sternohyoid and thyrohyoid both pull directly on the hyoid bone itself. So that's all pulled up by the suprahyoid, and then the infrahyoid will pull them back down. And these are the muscles that are all innervated by that component of the cervical plexus we talked about yesterday, that loop known as an ansa cervicalis. All right, we have two more muscles of the anterior or lateral neck before we look at the back. And sternocleidomastoid, most of you are familiar with this one. It's a thick membranous ribbon of a muscle that runs between the sternum clavicle and the mastoid process, so hence its name, sterno. Cleido refers to clavicle, and mastoid to the mastoid process. So, right, you don't have really long fingernails, you can grab a hold of this right here. Okay, that's the sternocleidomastoid. On the model, it's this muscle right here. Okay. Typically, the origin is considered to be the sternum and clavicle, and the insertion is the mastoid process. We can flip those around, and if we use the muscles stabilizing the head and not allowing the head to bend forward, then these muscles can be used to help to lift up the rib cage for someone who's struggling to breathe or someone who's working out at a higher altitude, and you need more than just your normal respiratory muscles. So the sternocleidomastoid is considered to be an accessory muscle of inspiration, helping you breathe in more deeply. But you have to change the origin and insertion points of attachment to do so. So origin, when it's not a respiratory function, again, is sternum and clavicle, my angle right here, and it's inserting onto the mastoid process. It has two heads, one to the sternum and one to the clavicle. And you're already familiar with the nerve that innervates this muscle. It's one of our cranial nerves that really isn't a cranial nerve, accessory nerve. By themselves, each muscle is going to pull on the mastoid process and turn the head to the opposite side. Now, if I use the other muscle, then I'm going to turn the head to this side. So turning the head from side to side as if you're shaking your head no, all right, would be sequential actions of each sternocleidomastoid. When you use them both together, you do flexion of the cervical vertebrae. So you can use the same muscle to say yes as to say no. If you use them alternately, you're doing this. If you use them together, you're doing that. Okay. So sternocleidomastoid. This muscle we don't show on any of our models. So to ask it, I'd have to show a diagram similar to this. It's called the longus colli. it's this deep muscle right here running from each vertebral body. So vertebral body over 2 or 3 vertebrae to the next vertebral body. And it shares the function with the sternocleidomastoid of flexing the cervical vertebrae. So when two muscles do the same thing, we use the term where they help each other, we use the term synergistic. Neither muscle is the primary mover, or they're each helping the other. So they work together with each other, they're synergistic. So longus coli and sternocleidomastoid would be synergistic for flexion of the cervical vertebrae. There's also some fibers that attach to the transverse processes, so there's some rotation, not as much or as much strength as sternocleidomastoid.